We're required to. State and federal law require these services. I think as a country, we've decided, apparently, somewhere down the road, that we want that everyone deserves some basic dignities. And some of those things are just having a place to live and having, basic human dignity is what our programs provide for people. And we're federally required and state required as well. So anything that's not federally mandated is typically state mandated. Minnesota as a whole likes to view itself as kind of an innovative state, and we are. So we tend to do, if the feds require, 5 things, we do 7. Which is frustrating sometimes, but also means we have a really good system in place too for people. So I think everything we do is because it's required. We exist because we're federally required to exist.
What services do you guys provide?
All right. Like I said, we provide child support, both establishment of orders and enforcement of orders. We provide adult mental health, children's mental health, child welfare, child protection, adult protection, developmental disabilities, licensing, cash assistance, medical assistance, food support, child care assistance. I think that's it. Within those, we have multiple, there are, I think, 25 different kinds of medical assistance. And they all have different rules, they all have different, that's the other thing people don't, so you look at our eligibility workers, and, well, anyone can do that. Oh my gosh, they have to learn so much. They have to learn so much about incomes and assets and what's excluded and what's not excluded, and if you're eligible for this or if you're eligible for that. We also provide cost-effective insurance for people who work and their work provides insurance, but it's extremely expensive. We do cost-effective insurance where we help pay for that because we want to keep people on private insurance whenever we can. We don't want to have people on medical assistance if we can prevent it. We also do collections, which is not a popular thing, but we do that. So, and chemical dependency. We do collections, so if someone's in the nursing home and they spent $500,000 in medical assistance, which easily happens, not at all hard, when they pass away, we go back and collect those dollars from their estate. So when they sell their assets or land or whatever, people don't love that, but I explain it. I explain to the board and I explain to everyone that, medical assistance is a big pot of money, and if we never put anything back in and we just take it out, there's not going to be anything left. Or it's going to be all new tax dollars, and people don't like to pay taxes either. So we have to collect some of what's owed to us when we can. We can't a lot of times, but when we can, because it goes directly back into the same pot. It helps fill that pot back up again, so it doesn't have to be relied on solely for people's new tax dollars. So we provide chemical dependency services too. We do Rule 25, so assessments for people, and we help pay for treatment if people cannot afford, if they're within a certain income range, we help pay for treatment. So we do that as well. That's another area that I forgot about. Let me see, what else do we do? We do a lot. We also provide, people probably don't know this, but county burials. So if someone is indigent, if they die and they don't have any assets, they don't have any money, Minnesota has again decided that as a state we feel people should be treated with dignity even in death, and so the county is charged with paying for their burial and making sure they get buried or cremated and buried or whatever they want. The county pays for that too. I wouldn't say we pay a ton of it, but we do pay for some of them.
How might someone access your agency's services?
Well, you can access your medical online. So you can go online into the Met system. I think they call it MNsure, but if you go on to MNsure and your income hits our threshold, it'll flip you to the Met system, which is kind of one of the same, but not really the same. I do think people sometimes are on public assistance insurance and don't realize it because they've went through the MNsure system, but for us it's the Met system. So you can do that online, and you never have to walk in the store, frankly. You can access our services, like our senior services. You can access those by going to your senior centers. Our mental health services, you can access some of them through mental health centers. We do provide certain things, some to the school. The schools will have access to referring to us and to making referrals for us. Child protection, I'm not 100% sure here. I know in Grant County you can go online and fill out a child protection report and email it to us. You don't have to come in, you can fill it out that way. We're getting more and more automated. You can pay your child support at the dollar store. Who knew? But you can. You can pay your child support at the dollar store. You can mail it directly into the state, or you can bring it in if you want. Either way. But you could go to the dollar store now and pay for it. That's amazing to me. I'm like, who wants to pay for their... But you know, if you're working and our hours don't fit, then it makes sense for you to go there and pay for it. I mean, that's okay. So we try to make our services as friendly as possible, as easy to get as possible, and then we try to explain it as simply. I mean, they're complicated. Our services are wide-ranging and complicated, but we try to simplify it so people get it. We also make an effort to be at community events and to have a booth and to say, this is what we do, this is who we are. If you want to get licensed, we'll come to your house and do it, because we have to. We have to inspect your house. So we do some of it in your home. You can access us just by calling, and we'll come to you. We also do, see, another thing I forgot, we do what's called Min Choices assessments. So if, and this is a scenario we would get, someone would call me and say, I think my parent is, I don't know if they can live at home alone anymore. Or my child has some significant issues and I don't know what to do. We do a Min Choices assessment. We send Public Health and us, we send someone out to do a full assessment of their needs, their scope, their financial situation, and we enter it all into this big system, and it pops out for us with a lot of assistance from us what programs they would maybe be helpful for them in the kind of disabilities realm, disabilities and elderly realm. And then we help connect into those services. So, we do a lot of things in people's homes. A lot of times this office looks empty because most of my social workers are at schools, are at people's houses, are, if we have a child placed and we have them placed at the Gerard, like a residential facility, they go visit them there. They're not coming back here for a visit, so we go visit them there. So we're all over. We're everywhere. But we want you to be able to walk in the front door and say, this is what I need.
Yeah.
And us to connect you to the program. We don't expect people to know the nuances of it. We expect them to just tell us what they want and what they need, and we'll help them from there.
And last question is, what impact does your agency have on the community?
Well, we keep children safe, and that's huge. I think that children are allowed to grow up in a safe environment, in a home that is safe and clean, and where they can be nourished and they can be educated and taught so they can grow up to be productive adults. I think that's a huge piece of where our community sees the benefit of what we do. But I also think there's two different sides to this. We impact people, and when we impact people, they can function better. So if you have food on your table, you can focus on getting a job. If you've ever looked at the hierarchy of needs, the basic is food and shelter. We help provide food and shelter so they can move up to the next level and start to work their way up to that Maslow's hierarchy to meet the other needs, and then they're more productive people in general. We help them, we help people through some of their hardest times and get them back on their feet so they can rejoin the community in a positive way and do positive things. What people don't like to talk about or often talk about is that we also provide, we bring a lot of money into the community, because every person who's on medical assistance, they go to your clinic, they go to your pharmacy, they go to your chiropractor, they go to your dentist, they use your grocery store with their food support dollars. We are an economic generator, and people don't like to think of it like that, but it's a reality. I can tell you that I would bet, because I know Grant County's numbers and I know the size difference, that there are probably close to $20 million brought back into this community through the programs that we administer. We pay for people's daycare. We bring over $1 million of child support is distributed through us. So children, we know that one thing that keeps the single biggest thing that keeps single mothers out of our system, out of our financial system, is receiving regular child support. We collect their child support, and they can be more productive, their kids can be more productive. So I think the impact is huge. I think people prefer not to think of it, and I get that, but they don't like to talk about the economic impact. And we, by far, our programs generate a tremendous amount of revenue that feed directly back into this community, because people that don't have any money often don't have a reliable transportation. They're not going to Alec to go to Walmart to get their groceries. They're going here because they don't have a car. It's the nearest for them. They don't have gas money to go for groceries. That's a luxury that they can't even think of. So same with medical services. Whereas I might say, well, I like the doctor in Alec, or I like the one in St. Cloud. If you use medical assistance and you want to get mileage reimbursed, which you can get, you have to use the nearest provider. You have to stay close. Most of our clients they go to the doctor locally. So those are dollars that go into your medical systems. And I think too, pharmacies, all those places, yeah, we put a ton of money into, our programs put a ton of money into those kinds of places. But people don't like to talk about that. But that's the impact, I think, from my perspective.